Hello and welcome back to Build and Thrive, the podcast that is dedicated to improving the health and the happiness of the construction industry. I'm your host, Jennie Armstrong, and before we get started, just to say a big thank you to our sponsors, GKR Scaffolding. So, today's guest is someone that's really exciting, and if you work in the space of health and well-being, I'm guaranteeing you will have definitely heard of her, or if not, definitely read some of the research that she has produced. So, today's guest is Jo Yarker. So, thanks for coming on, Jo.
Thank you for having me.
And Jo is a professor in occupational psychology. She's a managing partner at Affinity Health. Is that the correct?
Correct.
Affinity Health. And I'll get Jo to explain a little bit more before we get started about her background and her role at Affinity. So, Jo, welcome.
Thank you so much. It's wonderful to
Yeah.
be here.
I really appreciate you taking the time out of your busy schedule. So, can you just start telling our listeners and our viewers a little bit about your background and the work that you do at Affinity?
Yes, absolutely. I'm co-managing partner of Affinity Health at Work with my colleague, Dr. Rachel Lewis. And I also have an academic role at Birkbeck, University of London. And there I have specialised in occupational psychology. So looking at how we keep people in work, how we keep them safe and healthy in work, but also when people fall out of work, how do we support them back into work? And our work at Affinity is really broad across that health and wellbeing space. So we do research and consultancy. We look at how organisations design their health and wellbeing strategies, how that links with other aspects of organisational provision and business objectives. And then we also roll out tried and tested evidence-based tools and practices. So around training, guidance, and also tools to support people back into work at the end.
Brilliant. And yeah, and for me, the bringing out the principles about evidence-based practice
Mhm.
is such an important part. And I think we'll obviously touch on that a lot through today's session. But I see it quite regularly that there's organisations doing lots of great stuff, but actually,
Mhm.
does it make a difference? And then perhaps not really thinking about how they evaluate the impact of what they're doing. So lots of wasted resources and time. So hopefully we can draw out some of those, really good initiatives that you've seen that can make a difference. So let's talk a little bit more generally, rather than just about construction to start off. Where do you see the world of work at the moment and how it's addressing mental health? What's your kind of latest viewpoint on that?
It's a really mixed environment, I
Mm,
think, and I'm sure many of your listeners will be among those that are really trying to roll out different activities, really improve the health of their workforce. But the reality is, and lots of recent reports have shown that, is that as a country, as a society, we're in a pretty bad
mm,
place, and
yeah.
we need to do a lot more. There are a lot of brilliant efforts going on within organisations and within communities as well, trying to reach those workplaces. But I think one of the things that we're really struggling with is moving beyond awareness to real prevention. And I think this is where
Yeah.
um, occupational health and safety professionals can play a really great role, working with other partners to get at that prevention space. So moving from understanding that it's a challenge, knowing that we do need to talk, but actually what do we need to do to
Yeah.
make things different?
And I'm seeing that definitely in the construction industry. There's years have been spent with awareness campaigns and initiatives,
Mm.
and really passionate people, as you say, trying to do the right thing. And it's that next step, right? How do we look at the prevention piece? I know, particularly with some of the clients that I'm working with, they're very good at health and safety. They understand how to manage risk generally, but it does feel quite a different thing about taking that into the psychosocial or mental health risk. It feels like quite a big gap. Are you seeing anything from construction that has, made you feel that we're moving improving, or are we a bit behind compared to other industries? Is there anything that you've seen from your research?
I think it's a really interesting question in the sense of every sector, every organization um, wants to understand how different they are or how similar they are
Mm,
to other sectors. And I think that actually there's so much more nuance than that. There's so many differences within organizations, so many differences between organizations within the same sector. I think one of the things that has been really fantastic to see within construction is a real drive to make a difference.
mhm.
So certainly with Mates in Mind and other activities, there has been a real strong push to improve mental health, and I think that's very needed given
Yeah.
some of the really serious within construction. There has been a real push to do better, and certainly to support those individuals that are struggling and in crisis.
Mm.
So we see, for example, with Mates in Mind, we see many of the big programs really making sure that they embed for the whole of the build and construct, regardless of it being for their organisation or for the very small contractors
Yeah.
in their supply chain, really making sure that they have things in place for people that are struggling. I think one of the things that we're starting to see as well with some of the bigger organisations is that stepped approach to look at prevention as well, thinking about how they might risk assess both for those more safety oriented
Mm.
elements, but also for the psychological elements and the psychosocial risks up front at the beginning of projects and reviewing throughout projects, which is absolutely brilliant to see. And we also have a couple of clients that are in the construction sector looking at reviewing their provisions and really wanting to ensure that they've got that whole systems-based approach, but also then thinking about what evidence-based interventions can we roll out?
Yeah,
How do we
sure.
make sure that we've got potentially we have first aiders or we have champions, but we also have really strong evidence-based or evidence-informed activities that will change the way that work is designed or provide tailored support to ensure that people can develop their skills and confidence in having the
Yeah.
conversations that lead to action as
Yeah.
well.
It's hopeful. It gives you hope that things are moving in the right direction. I know that there seems to be this obviously with a project, you have a client, you have
Mm.
principal contractors, and all the supply chain. And I think perhaps what's happened so far is that there's been a bit of like, well, that's your person, you deal with them. That's me. This is our area of responsibility. But actually, for a
Mm.
project to succeed, you're all coming together, all working together, and those
Yeah.
risk factors, will go between company and company. So it's positive to see that's happening. I do still feel like there needs to be a bit more of a push to say, actually, as an
Yeah.
industry, how do we really look at the risks? And everyone will quote the long hours, the demands, the poor contractual relationships, but are they taking that forward?
Mm.
We had Andy Mitchell and Steve Howes on before, and we were talking about the role of the client and actually how important that is for them to set some ambition around this and to lead the direction about looking at those things. They would openly admit they didn't get it right every single part of
Mm.
the time, but hopefully we're seeing more clients that are going to drive that, which is, yeah, gives me hope for how we might improve in the industry. One of the things that when I work with organisations, they'll talk about the barriers in the way to doing more things around
Mm.
mental health. I mean, do you see any particular regular challenges that organisations have to move things forward?
It's a big question, isn't it?
Yeah,
And I think absolutely there are so many different things, and we see that through our consultancy work. We work with so many professionals from health and safety, from HR, with wellbeing roles that are looking for ways to really ensure that they can cascade that good practice. We also did some work for the World Health Organization to contribute to the guidelines that of mental
yeah,
health at
wow,
work. And what we did there was review the evidence for implementation barriers. So what's getting in the way when you're trying to roll out different activities to support mental health. And a whole raft of things are
mm,
known to get in the way. So we know that where and when you roll out different activities, that makes a really big difference. So we're having a conversation this morning with somebody around, well, what are some of those tools that you can use hosting the same event, but in many different places, in many different mediums, in different time bounds as well, so that you can really start to feed small messages early
yeah, yeah,
and gain the buy-in. But also that senior leader
yeah.
piece is always something
I
that
thought
comes
this was going
up.
to be the top
Yeah.
one of the top ones. Yeah,
And I think one of the things that is really starting to be recognised across board level groups is the recognition that it really does hit the bottom line. So we
mm,
can see that when people are in good health and when they are able to manage their health conditions in work, they're able to perform, and that leads to good results in terms of profitability, but it also leads to retention and it leads to a
yeah,
good culture. So that recognition that we need to move beyond employee engagement to think really, how does health link to productivity and performance and other aspects like retention is key. I think there's one thing there, though, that is also hooking the senior leader attention, is that we know that in so many of our professions, and I think probably construction is not top of that list, but it's starting to come to the fore, is when people are unable to manage their health and well-being at work, their performance may suffer. They may then make a mistake that might lead
Yeah.
then to a disciplinary. But we also know the harm around disciplinaries and investigations is extraordinary for not only the individual, but also those around them.
Mm.
But it's also time out of doing the job for several people potentially. So um, that is also having a cost for organizations. And so thinking about that relationship between people, processes, how people behave within those roles and business objectives is becoming
Yeah.
something that is recognized more freely, I think.
Yeah, it's good. And I'm just again thinking back to construction dynamics. I think again where we have this churn of people, we that whole recognition of you look after these people, they'll stay with you, they'll be more productive. But from a project life cycle, construction teams might move on or they might move to
Mm,
another project. You miss that opportunity perhaps to see that feedback more regularly. I mean, a project's performance should give you an indication, but people will move
mm.
from job to job and people will move throughout an organization. And I think that's a big area where construction struggles
Mm.
with, and they'll always have other factors. They'll be like, oh, it's the client that's causing this problem, or
Yeah.
it's this, or we haven't got enough budget for this, and they lose that connection with this, the I suppose the organisation's performance and the role of their well-being. Or
Yeah,
yeah.
and I think that brings out a real, perhaps a quite a unique thing within construction is perhaps some of the individual cost is hidden because
Yeah.
when you and this is a barrier to really taking action, I think, because the drive to make sure people are on site, to make sure that projects
Hmm.
are kept to time, it means that you can't afford in the same way that perhaps you can in a professional services role to have somebody not in post for a
Yeah.
week because that has a huge impact
Hmm.
on
Yeah.
everybody's delivery of the job. And so what we see in construction often is that people make sure that that role is filled in the short
Yeah.
term, which really means that those individuals that are perhaps experiencing ill health or need some time out for other reasons, when they get back, their job is taken,
Yeah.
and it's not something that often is a process that you slip back into your original project.
Yeah.
You often then step outside and have to look for a new project. And what we know when people are returning to work after a period of ill health is that journey is really
Yeah.
hard. And so having to do that often without the support of the team that you might have been working with for a couple of months or a couple of years, often also at the same time almost having to recruit for a new job
Yeah.
and interview for a new role on different projects is a really difficult thing. So I think there's a hidden challenge as well
Yeah.
for people in construction.
When you're talking, it's making me think about all those scenarios where people, have literally that have taken time off, they've been replaced, and someone's come in. And equally, the other thing that just made me reflect on was when people have come back to work after a period of ill health, they build those relationships up. Their colleagues support them.
Mm,
They know those people, and then they move to another job, and they've got to go through that whole process again of trying to build the support networks around them. So it becomes this roller coaster of challenges, I think,
mm.
for people if they are struggling or that have mental illness, that they need that support. So yeah, there's definitely its unique challenges. um One of the things I know that you do a lot of research is about the role of the line manager, and I think this is again is such an important part, particularly in some of the smaller contractors where you have supervisors that are putting people to work every single day. And again, a bit of a macho image that we still have in construction. It's a bit right. They meet those people for the first day. It's get on for work and get on with your day and deliver what you need to be doing. When you've looked at the research, what have you found with the role of the line manager and how important that is? That's yeah, I suppose some things that may be relevant to construction, but even the wider industries. Yeah.
Yeah, absolutely. So, one of the things that's interesting around manager behavior is our research has shown, regardless of where you work, actually, whether you're working in a hospital, on a construction site, teacher, what you want from your manager is broadly the same. So, the behaviors are very, very similar, regardless of context and also regardless of level.
Mm.
And so we've been working for many years. We did some work for the Health and Safety Executive back probably 20 years ago now to look at, well, what are those key behaviours that prevent and reduce stress? And we asked the managers what they felt they were doing, what good looks like, what they felt poor looks like. We also asked employees, and we thought that we would find those sector differences or those level differences, and we didn't. And the key behaviours, there are four broad competencies, but essentially what we're looking at is whether your manager can manage the workload
Mhm.
and support you in that, whether they take accountability for when things go wrong or when you need support. Is that something that they step into? And also being open and available and having that
Yeah.
personalized contact. And I think that thread comes through all of our research. When we're looking at particularly those environments that are thriving, we know that the manager plays an absolute
Yeah.
key role in that. But also, we know when people are struggling, um, those that return back to work, our research has shown that actually those that return back and feel more confident in their return and sustain their work are much more likely to have a manager that was supportive before their absence. So, and they had a good relationship with their manager before their
Yeah.
absence. So
Yeah.
it's not just that we need to think about manager behaviour when things go wrong. We need to think about it all the time because actually how that foundation is made really predicts future
Yeah.
actions for
Yeah.
our teams. So yes, it's one of those things that we often don't really see as well, that organizations look at their competency frameworks and their
Mhm.
development in relation to what those pivotal behaviors are that predict good health and
Yeah.
well-being. And I
Yeah.
think there could be a lot more that we could do to just cross map and make sure that when we're looking at our competency frameworks, yes, they predict performance and they embody the company values, but do they also include those key behaviors
Yeah.
that
Yeah.
really make sure that people can thrive at work?
Yeah, it's interesting. And I suppose with the research, have you, is the solution here training to get them to have those behaviors? I imagine some of those behaviors are quite hard to train people to have if sometimes people haven't got that inclination to be that caring in that way. But is training the
Mm.
solution
So
there?
I think there are various things. So awareness is key
Yeah,
first.
yeah,
Sometimes we just don't know that that's how we're coming across. So raising awareness, having a clear understanding of how you're received by others and where your strengths are, where potentially your gaps are, and whether you want to develop those or whether you need to be aware of it and recognize actually that's not a skill set that I have. So therefore I'm going to draw on these other resources to compensate for my
yeah,
team.
yeah.
But also I think that they are trainable.
Mm.
There are things that we can learn, there are things that we can grow into. And one of the key things is being consistent as well. So, what we know is that managers that are inconsistent are much more challenging than those
Mm.
that are fantastic and embodying all those behaviors half the time and then really unpredictable the other. So for those that don't want to invest and really look at that consistency of behavior as well, it's almost in a way better that they were they didn't make the effort. I'm not going to I don't mean that really, but the inconsistency is
Yeah,
really challenging for people as well. So being aware of how consistent you are and under what circumstances is something
yeah.
that can be developed, because once you're aware, you can start to notice those
Yeah,
sorts of things.
sure. And actually, the line manager the self-assessment tool the
Mm.
HSE have, you produced that. Is that part of the
Yeah,
work that you
so
did?
that
Yeah,
that was a long time ago, but yes,
yeah,
it's still used and still applies.
yeah. And I've used that regularly with
Mm.
people. And like you said, that moment to have that opportunity to self-reflect on some of the things that are in there. Again, I don't think we see that regularly in construction and that opportunity, and probably more so because the stress levels are high. They haven't got the time and space to be doing that
Mm.
time to reflect on those skills. It's more about delivery and meeting program and cost, etc. But yeah, we'd like to see more of that, I think.
And the great thing about those behaviours is there's been quite a lot of research that has taken them and tested them in different ways, and we know that actually the same behaviours are not only across sector but in different countries as well. So there've been
Mm,
academics in Japan and in Australia that have used those same behaviours to see whether they make a difference,
yeah,
which is
it's good.
great
Yeah.
to see.
easy something for people to pick up and say, right, let's use this as a ready available tool. It's free, and yeah,
Absolutely.
something
And
to
I think
start.
also if you have those behaviors embedded and managers are supportive or even alert to the fact
Mm,
that they make a difference, that's one step. But also equipping managers with that knowledge around, what are the ingredients of work, and we talk about psychosocial factors
yeah,
and
yeah,
and what work looks like. But often when you talk to somebody who's been struggling or is unhappy at work, they just go, I don't like work, or my
yeah,
manager's awful. But they find it very hard to say what that really looks
yeah,
like and
yeah.
and and tease it apart. And so I think helping managers understand the frameworks for psychosocial risk, looking at the health and safety executives
Mhm.
management standards, if they're working internationally, looking at other frameworks as well. We have a framework which incorporates those that are regulated in other territories. And when managers are aware of those different ingredients, and also when employees have an awareness of that, you can solve problems a little bit easier as well, because you can start to pinpoint and go, oh, okay, it's not just work as this big bubble that
Yeah,
is a
yeah.
real challenge. It's actually that I like more control over this aspect of my job, and I haven't got that at the moment. So how can I have a discussion about that?
Yeah, yeah, and I think there's still an element of people seeing work related and non-work related, and putting a lot of emphasis on the non-work related. All
Mm,
this stuff is stuff you're bringing into work is not what we're causing, but actually, like you say, the HSE management standards is a such a simple thing for people to start looking at the different elements. Let's talk a little bit about health and safety professionals. So, and I've been quite vocal about this in my career, and not criticising all of the health and safety professionals that are out there, but there's always been a stronger focus on safety. I definitely think the health side of things is getting
mhm.
stronger, but I know many of my colleagues would say I'm a safety professional, not a health and safety professional. If we come back to psychosocial risks and mental health risks, how do you see perhaps the role of the health and safety manager to really help us on this journey about moving into prevention? I think they play such a key part in risk management generally. I feel this is such a important role, and where we can make such a big difference in construction.
Yeah, absolutely. I'm so pleased you've brought that up, because I think that health and safety professionals have a really difficult job, because it's probably the one area um, of all of their different risk management aspects where the assessment lies with them,
Mm,
but actually the controls
yeah.
are very much out of their control.
Yeah.
Whereas if there is a physical risk, there is a very quick, or not necessarily quick, but there's a direct route to taking
Yeah.
action, and that's something that has been a foundation of safe workplaces for so
Yeah.
many years now,
Yeah.
that it's a given, and there are budgets allocated to it, and there are processes to access
Yeah.
those controls to mitigate the risk. When it comes to psychosocial risk, the controls are much more complex, and
Mm.
also we aren't entirely sure that when we use a control, it's going to work. So um, there are two aspects to that. So one, those relationships between health and safety professionals and HR,
Yeah. Yeah.
also occupational health teams, if they are embedded. What's been brilliant is to see occupational health taking a more preventative
Yeah. Yeah.
step as well. And I think all three of those key professions, all of which have very many different disciplines involved
Mm.
in their makeup, often in the large organizations, um, all of them are going on a journey, and they're all at different stages
Yeah.
at the moment. And I think that that's something that's really difficult for health and safety professionals. So one, it's a challenge. I think two, it's been great to see the scope of education in this space,
Mhm.
because it is a really different, not only a different knowledge base, but actually I think to make the difference and to have those conversations and to really get to the bottom of what the risk is, the real root of the
Yeah.
risk,
Yeah.
you need a whole different skill set
Yeah.
to many skill sets that health and safety professionals are used to and develop over time. And I also actually, this is a hypothesis I would love to explore, but I think people that go into a health and safety role, and do that journey of education, they like often the absolute, the attention
Yeah.
to detail, the certainty that if I do this, this happens,
Yeah.
and that's a particular preference. And the ambiguity that comes with managing stresses with psychosocial risk is a really different skill set
Yeah.
and a real different preference as well. So I think that's something we haven't really talked enough about or teased apart and supported people
Yeah.
to recognize in the way that we manage
Yeah.
risk in this
It's really
space.
interesting. I hadn't really reflected on that, the control piece, and as you say, that is very much how health and safety work. This is the risk assessment. This is the controls. We'll monitor to see if it's effective. When I work with organisations through this process, we it often is starts off with HR teams saying, well, it's a risk assessment, so it must sit with the health and safety team.
Mm,
And then the health and safety team, well, I can't do anything about this, it sits with the HR team. And just trying to even get the right people in the room to talk about how do we make that process work. But every organisation is so different. So it's not like a one size fits all that this is where everything goes. And but again, come back to the role of line manager, getting them to understand that is where the difference actually is made. Yeah.
exactly. And I think also having that real senior leader support. So, one of the things that we have often seen is that health and safety, those that have tried it, often feel quite burnt by the experience. If
Mm,
they, and I suppose there are also many that are doing it and it's working well
yeah.
for them. But people will come to us when things have gone wrong and they've run a risk assessment. The findings really highlighted quite a few significant risks around workload, around relationships. They've tried to take action, or action hasn't been taken, and the pushback from the employees is really quite significant,
Yeah.
understandably, because they're expecting action. And I think one of the things that perhaps in those cases hasn't happened is that really careful setup at the beginning. So thinking about, who are my senior leaders?
Yeah.
Have we got buy-in for this? Do we recognize what is likely to happen? So learning from other organizations or what we hear from our employee voice activities or from our HR BPs, what is it that's likely to come up? And have we got resources to tackle that?
Yeah. Yeah.
And it takes time, and it also takes, well, it can take 2-3 years sometimes to tackle some of
Yeah.
these
Yeah.
problems. But it also takes budget and resource, because people need to have the headspace and the time allocated to manage
Yeah.
that at the local level as well. And I think we often see that that isn't put in place up front. And so people embark on what is seen as a risk assessment like any
Yeah.
other,
Yeah.
and actually it's really
So
not.
much more,
Yeah.
yeah. Ticking the box to say, right, we're legally compliant if the
Yeah.
HSC visit, we've got a risk assessment, but as you say, it's the following. I mean, I'm a huge fan of ISO 45003 because I
Mm,
like that principle of continuous improvement,
mm,
and I'd like to see more organisations, even if they don't go for the actual certification, but just to follow those principles and actually to accept that you're not going to get it right immediately, but it's that journey of how do you
mm.
continuously look for ways to improve. And I don't know, do you have any opinions around that as a standard or anything like that?
Yeah, I think we and several of our clients have gone for,
Mm,
and I think it's a really good standard. It's really clear. It enables you to see which structures you need to have in place to be able to
yeah,
manage your psychosocial risks well. I think one of the things that we have seen is that those organizations, you can have organizations with very good structures in place, but actually when you go and talk to the people, the
yeah,
reality, the lived experience within different pockets of the organization can be very different.
sure.
And so you could have the policies and practices and the provisions, but the employees don't
So that, yeah,
necessarily know about them, or they're not being implemented on the ground. And I
yeah,
wonder whether with the ISO that's sometimes not picked up
yeah,
as clearly
yeah,
as some other frameworks. Likewise, you can have people who have really good cultures, really proactive, preventative cultures from a psychosocial risk point of view, but actually they don't have the systems in place
yeah, yeah,
to manage. So I think there is something for us to learn. Who does the ISO work for, in what context, and how do we bridge this gap between
yeah,
the
yeah,
cultural piece and the
yeah,
systems piece? Because sometimes they're doing all the right things, they just don't have the paperwork
yeah,
behind it. And maybe in some of those organizations that isn't needed.
yeah,
And
yeah.
and um how do we acknowledge that?
Yes, yeah,
Um
it's interesting reflection, and yeah, I think it's definitely something that maybe something for some research in the future
Mm.
to see about how the ISO standards actually make a difference in the lived experience. But yeah, and I think from my experience, those organisations that want to go for it often are a step ahead already because they've got the right culture and they're looking at that, right, well, how much more do we do?
Yeah.
And the fear is that you get lots of organisations saying, right, we want this standard, and it becomes the tick box, as you say, and not actually improve the lived experience. But no, watch this
Mm.
space. We'll see if that
Yeah, and
emerges.
we have so with our research consortium, we developed a maturity framework, which is a meta framework, really.
Mm,
So within it, we have various aspects around governance, around good jobs, around employee voice, around the provisions that are in place as well. And I think one of the things that allows us to do through our consultancy practice has been to meet people where they are.
hmm
So use that framework, and underneath it is mapped in all of the other frameworks that are in our space. And therefore, if people are ready to go for the ISO, then
Yeah,
then they can.
yeah,
But if they're not, they can see what are the next steps that I need to take as a business. Where do I need to focus
yeah.
activities? And it allows that path journey,
Yes,
which
and
is
important, yeah.
helpful.
Rather than thinking there's this huge mountain to climb and it's
Yeah.
probably going to take me 10 years to get there. Yeah, yeah,
Exactly,
that
and
journey.
the ISO, rightly so, is incredibly detailed,
Mm,
which is really concrete for actions,
yeah.
but also maybe for some of those that are newer to um,
Mm,
their journey on this, a bit
yes.
overwhelming.
Yeah, definitely. One of the things that I'd like to touch a bit more on, so in the health and wellbeing space now, there is so many initiatives, apps, training
Mm.
programs, everything that comes on, and I can imagine for a lot of construction firms, they get sales calls a lot saying, right,
Mm.
try this latest thing, try that latest thing, and I must admit some of the things that I can often become frustrated with is I see a company's invested a significant amount of money, like in an app, for example, but not
Yeah.
really looked at the evidence base or not even known the questions to
Mm.
ask the provider to say actually how much difference does this make. What do you see in that space? And then also, have you got any recommendations about what organisations should do if they're going to be investing in
Mm.
a new product or service?
Yeah, that's a really good question, and it's certainly something we see. It's
Mm.
bamboozling, isn't it? You go to a conference or an event
Yeah, yeah,
space, and there are just so many different things
yeah,
available to you. And I think one of the things that has really shone through here is there's that innovator challenge. So when you are innovating a new product or service, you have a choice to invest in the evidence or invest in the look and feel.
yeah,
And so
sure.
I think now we've also got this slightly polarized um, marketplace where
Mm.
some things look a lot more glossy than their actual foundations would suggest.
Yes.
Others have both, and that's brilliant. But in terms of that decision making process, so we were really lucky to be involved in some work. So we led a project with the Society for Occupational Medicine because they were saying people are coming to us going, how do I make these choices? How do I limit the cognitive load of all the calls and all the information, and what do I start to look out for? And I think because of a shared passion to drive that evidence-based
Mm.
practice, what we did, we spoke to lots of experts in research, in developing products, in delivering services, but we also spoke to people who were buying products and services about what they needed and the
Yeah.
decisions that they were making. And so there's a guide for wellbeing products and services on the SOM website. But essentially, what that does is walk you through what you might want to go through. So the
Yeah, yeah.
first thing is understanding what your problems are, like what problem are you trying to solve, and then looking at the solutions you have already. And in that space, what we find is often people have a lot of solutions in one area and none in another.
Mm.
And there's often a mismatch between the problems and the solutions that they're providing. And this
Yeah.
is something that we see in nearly every organization, just because services evolve over time, don't
Mm.
they? And you often have legacy services that are still there because you bought a package from
Yeah.
somewhere, and it's really about thinking, how do we deduplicate effectively? How do we make sure that we're investing in the right
Mm.
areas? So understanding those challenges, and there we often use the Igloo framework. So thinking about that whole system approach. What is it that keeps people healthy and well? So it's individual factors, so individual characteristics, but also their individual capacities and techniques that they can use to manage health and well-being. but also the group level. So what is it within the group
Mm.
that people are drawing from? What are the group relationships, the team working? The leader behaviors. So we talked about our line manager behaviors. How are they supported and how do they behave? And then at that organizational level, what provisions are in place with regard to EAP provision or occupational health
Mm.
provision, but also the policies and practices. How are they cascaded? How are they written? All of those sorts of things. And then what's outside? So construction has a lot of outside resource as well.
Mm.
And so we'd use that framework to think about what's in place and are we leveraging tools at each of those different levels. So
Yeah.
that's one thing. And then the other is to see the balance between prevention, capacity building, and support. And what we also find there is that many of the provisions are at that support
Yeah,
reactive
sure.
level. And so that gives an eye of, okay, I've got enough here. I need to really focus on on
Yeah.
prevention, and what does that look like? And then when we're looking at the evidence, what we know is that when when we know that they're designed in a way that follows good practice of developing an
Hmm.
idea um, to an intervention, then that can be a really good way to tease apart. So, was it co-designed? Was it theory led? I know for those we all have in our different professional journeys a moment where we have to think about theory. And for many years, I thought, oh my goodness. But actually, what's the foundation?
Yeah.
Does it logically make sense that this product and service will address this outcome that I want to
Yes.
achieve?
Yeah.
And we often don't think about that. We just think, oh, it will sort out mental health, but actually what's the problem?
Yeah.
That mental
Yeah.
health is the outcome, not the source of the challenge. And so is it well designed? Considering who it's been designed by and so on. But also then when we're thinking about putting it in place, are we making decision are we really thinking about the implementation process? So
Mm.
a lot of work has to go into that. The
Yeah.
messaging, who we're starting with. Maybe we've got some early adopters and we're going to then
Yeah.
build
Yeah.
on those good messages. And then how do we sustain it over time? So there's some great activities, really evidence-based initiatives that then fall flat on their face
Yep.
because we haven't got the resources past that first year to make sure
Yeah.
that they can really embed. So it's thinking about those things and then also thinking about how you're going to evaluate. So is there a pre baseline that you have and then a measure afterwards that you can see where that changes? Are you measuring just reactions? People like it.
Yep.
That's all
Yeah.
good, but that doesn't necessarily change behavior, certainly
Yeah.
doesn't change outcomes. It's a useful step in the right direction. But thinking about all those different things from the choice originally, the design, the implementation, and the evaluation, and that whole journey
Yeah.
is something we need to have on our radar. And something that we do with many of our clients is to really look at what do you have in place? How are you making your decisions?
Yeah.
And from the products and services that you're using now that make up your whole health and wellbeing strategy, um, where are you in that maturity of your journey in using
Yeah.
good practice?
I could think about the amount of times you speak to organisations and like how many people know about these services that you've got, and you ask the
Mm,
employees and oh, didn't know we had an EAP. I didn't know we had all these things.
yeah.
Yeah, like you say, starting with some of what have you really got in practice is such a big gap, and hopefully there's given some people something to think about there. And I'd like to see more of the providers of these apps and things coming in with that as the starting point. Say right, let's give you
Mm.
that baseline data and help them to go on that journey. I suppose the challenge is the quick and easy thing is just to buy a product, put some money in, and hope it solves the problem, which hence why many people don't have that
Yeah,
success. Yeah.
absolutely. And you know, the evaluation piece, it can be tough. It can be
Mm,
really hard
yeah.
to get that data. And yes, if I think with my research hat, it's really hard. We've got a couple of evaluations going on that are trying to really understand what's working, why it's working, and it takes a
Yeah.
lot of effort to
Yeah. I
to
bet.
to really make sure that it's working alongside the rollout of a service. But once you do it, it's done,
Yeah.
and also it can it can roll on to other activities. So it's that
And
initial
this,
learning.
yeah, tell us a bit more about that kind of evaluation piece that Affinity do, because I think there's. Can you give us some examples of how that might work in practice? How you evaluate the impact of something?
Absolutely. So there's lots of different ways that we might do that. So say for example, on one of the projects that we've recently finished, so we've been looking at our Igloo Return to Work toolkit, and we were really fortunate because we got grant funding to evaluate
Mm,
that, working with Loughborough University um, and others. And one of the things that we wanted to do there is we knew it was well designed. We knew that it had been seen by employees who are returning and the managers as
mm,
acceptable. But what we didn't know is whether it does make a difference. Does it help people to return to work? So one of the things that you can do is think about using robust measures, so good measures. In a practice setting, we might use slightly shorter measures. So we did a big study with medics the other day, and they were saying, could we just have ten questions? Like, we can have 10 questions, but it's not really going to give us the richness that we need.
yeah,
So there's always a a very fine line between how much is enough, but really thinking about what is it that you're trying to pivot, what outcome, what's your primary
yeah,
thing you
yeah,
want to change, and making sure you've got a measure of that before and then after the rollout of any activity. So we looked at that with this return to work tool, but we also wanted to understand people's confidence and their knowledge and
yeah,
their general impression of how they were feeling. So we asked lots of questions around that before and at multiple time points to see whether it was making a change over time. And we also run what would be called a process evaluation. So this is something that um, you might use interviews to really understand, well, what's going on? How are you using the toolkit? What's
yeah,
getting in
yeah,
your way? Why haven't you used it this week?
yeah,
That's really interesting to understand because clearly there's a barrier. So you can pick up on the barriers and
yeah, yeah,
facilitators that go through that over time, so that by the end of that period, you can see pre and post. Did it make a difference for that one person? Did it make a difference for the whole group of people that went through? Did it pivot any organizational metrics? So, whether that be absenteeism, whether it be engagement
hmm,
on your annual employee survey cycle, but also that those interviews or that conversational data can really help you get underneath and see what's going on. And sometimes we can see that maybe it's not the intervention that was a problem, it was that the team went through a big change
yeah,
and they had a
yeah,
new line manager or the company was
yeah,
talking about demerging and so on. So it's really helpful to have that pre and the post, but also an understanding of what's going on in
yeah, yeah.
between to
Hmm,
see what's happening there.
fascinating.
And
And
it can work with any size organisation.
yeah,
So we're
yeah,
rolling that out. We've got a project looking at health and wellbeing services being cascaded through the supply chain. And so we're looking
ah,
at doing that with small organisations as well. And
yeah.
people are keen to know whether they're investing time in the right thing.
Yeah,
So
yeah.
it,
Yeah, and that'd be so
it works.
relevant to construction, and
Mm,
you often see some of the larger contractors wanting to do more for their supply chain. So this piece around the evidence
mm,
base, what's the right thing and how do we make that work, would be
yeah.
great for construction. So we're getting to the end. I've got a couple of kind of key questions to end on. Um, if you um had a magic wand and you could make one change in the construction industry today that you think might improve mental health outcomes, what would that be?
That is a tough question. But I think my key one would be for our large employers and our commissioning organizations to really think carefully about how have a holistic approach across each project that they commission. And I think that goes um, from start to finish. So thinking about how
Wow.
how people that are in that design phase and the setup phase are supported to work together in a collaborative way, that they have a shared understanding of what mental health is,
Yeah,
but also then as the project progresses and more contractors are brought in and others roll off, that there is that consistent culture that is supported.
yeah,
Because I think if it was by project basis, um, you'd have the opportunity to influence so many people's
mm,
lives, wouldn't you?
absolutely, yeah,
So it's really thinking, learning from how we can cascade through the supply chain, but also how we can really, for those organizations that potentially have the resources, look at it not as this is an extra cost to my project, but actually this might be the way that we can really optimize the
Yeah,
design and build process, because we will be able to take much more proactive
yeah.
approach all the way through.
I know when I had Kevin Bampton on, he talked about this principle about investment rather than cost. He said
Mm,
everyone always, oh, what's the cost associated with this? But trying to shift the mindset, this is an investment in the productivity in the program.
mm,
And yeah, easier to say than to actually feel it. But typically, um, a lot of projects, this is the afterthought. It's, oh, right, we're down the right road a little bit. What do we do at this point? And it then becomes campaigns and initiatives and
mm.
awareness days rather than fundamental differences. So it becomes quite hard in the contractual world. And if there was anything else that you would give as a kind of key takeaway for construction, anything else that you think, if we've got health and safety professionals listening or construction companies that are thinking, right, I want to move that journey forward in well-being as well as mental health, is
Mm.
there any kind of key things you say, right, do this?
So I think one of the first things is to really take a step back and think about what you know and where your gaps are as a professional. And I think one of the things that is very difficult is this space is huge,
Yeah,
isn't
it's
it?
massive. Yeah.
And it's very confusing.
Mm,
And so just thinking, okay, where do I feel confident, and where are my gaps, and who can I look to learn that
yeah, yeah.
that from? Who can I collaborate with that might have a different skill set with me? So I think the key point is, if you are working in a multidisciplinary environment where you can talk to occupational health, say, okay, this is the problem. How would you
Yeah,
look at
yeah,
it? What's the
yeah.
solution? Um, Developing those relationships with HR professionals as well, understanding that senior leader perspective, so that
Mm,
rather than seeing this is the health and safety risk that we need to address, it's okay, this is the problem that we all need to address, and how can we look at it in a shared way to reach the
mm.
best solution, I think.
Yes, very, very interesting. Um, yeah, and I'll make sure in the show notes I link to some of the resources that you mentioned from the HSE for. I suppose it was from the line manager, but also health and safety
Mm.
professionals might have some interest in those points. So just kind of finalising and finishing up here. What's happening now with Affinity? I know there were some other programs that you were working on, the Engage program. Is there anything coming up exciting for the next year, or
Yeah.
well, 2026 now?
Absolutely. So many different things. And actually, one really very much related to your last question. So, we've been with our research consortium, we have been developing a framework for wellbeing professionals. And so, I know many of your audience would not class themselves as wellbeing
Hmm.
professionals, but I think it would be an interesting thing to keep an eye out for, because what we've been doing there is looking at all of the different professions that are involved in wellbeing, and particularly those that call themselves wellbeing professionals,
Hmm.
and think, well, what is it that you do, and what are the skills and knowledge and
Yeah, yeah.
competencies that you bring, and the activities that you're involved in. And so there will be in the new year a framework that really pulls that all together and really speaks to so many of the things that we've been talking about
Yeah.
around what are those core knowledge bases that you might need to be a health and safety professional, but working in that wellbeing space, or wanting to bridge and
Yeah, yeah.
also work in that wellbeing space. What is it that you need to know about primary, secondary, tertiary interventions, and also the know-how to roll it out and implement it effectively. So that's one thing that I think is going to be really exciting in
Mm,
the new
looking
year.
forward to that.
And we've been working with different professional bodies, so with IOSH, with Society of Occupational Medicine, with CIPD. So it will be a really great
Yeah.
framework to be able to see where are those synergies, and also where are the places that you might need to draw on other groups within your organization. So that's one thing. The other thing that we're doing is the Engage project, which you mentioned, which is also really exciting. So, and particularly with the Mayfield review coming out saying that employers are going to need to really step up their evidence base approach to looking after their
Yeah, yeah.
people. And one of the things that we were really aware of is many professionals, they will go through their health and safety career, or their occupational health career, or their HR career, being interested in the evidence, having to do a
Mm.
research project potentially when they did their qualification, but actually really engaging in what's in the magazines, the professional body magazines or online,
Yeah, yeah.
but not necessarily knowing how to contribute to research or shape research and do research so that they can add to that evidence base, or even know how to connect with the latest findings. And so the Engage project is doing just that. So we're interested in talking to professionals across different areas of health and work to understand how they do research in their organizations, but also what they might need to do that differently so that they can really contribute to that growing evidence base so we can work out what is working, what's not,
Yeah, yeah.
and how can we make work better for
Brilliant.
everybody.
Well, definitely we'll make sure we've got the links to all
Thank
those
you.
things. So thanks, Jo. I really appreciate it. I mean, I got a lot out of the session today, just hearing your experience and your knowledge. So thank you so much for giving up some of your time. So thanks everyone for listening or for watching. We'll be back next week with another exciting guest. But I'm your host, Jennie Armstrong, and thanks for listening. Take care.